Hello everyone, this is Dr. Lakshmi Kalbande. I am practicing as a consultant obstetrician and gynecologist in Cloudnine hospitals, Pimple, Saudagar, Pune. So most of the times people ask this question that what is pelvic inflammatory disease or what is fallopian tube inflammation. So fallopian tube inflammation usually comes up when the couple is trying to conceive or not able to conceive since a long time and has had treatments otherwise elsewhere. So it generally involves pelvic inflammatory disease, which then causes fallopian tube inflammation. Fallopian tubes are basically the two tubes that are arising from the uterus, and they are kind of the fimbrial end are near the ovaries, so that they can catch an egg and transport the egg all the way from the ovary to the uterus. So in a way they are the transporting medium for the female gamete or the egg or an oocyte that we call to the sperm, which then forms an embryo and a pregnancy happens. So most of the times if there is an infection of the fallopian tube, this process is hindered. The cause of infections or inflammation are many. Most common is of course a vaginal infection or a pelvic inflammatory disease that we call. It is generally a sexually transmitted disease. So if the husband is having any infection, the infection may be transferred sexually to the wife as well. Also, lack of hygiene practices also play a very important role. Secondly, any abdominal TB or tuberculosis or childhood history of tuberculosis may have a very much damaging effect on the tubes, and that may in turn cause fallopian tube inflammation. So usually the symptoms are quite rare. It is usually diagnosed in an incidental manner, that we are doing an ultrasound or an HSG or a diagnostic laparoscopy for some other unrelated reason, and then we end up seeing an inflammatory signs on the fallopian tube. So usually it is like that. The symptoms are very few, the most common being vaginal discharge. The treatment usually involves a course of antibiotics, which is usually there for 14 to 21 days. And after the course of antibiotics, we again reassess the situation. The diagnosis is usually done by an HSG, because on ultrasound or sonography, the tubes are not usually visible. So unless they are fluid filled or pus filled, or what we call as a Hydrosalpinx or a Pyosalpinx. Unless an extreme situation arises, the tubes are usually not visible on the scan. So we have to take help of hysterosalpingogram and diagnostic laparoscopy to diagnose the inflammation. So treatment is usually medical, unless there is, like I said, pus collection or a water collection inside the tube, and then we may have to do a surgical removal for the treatment of inflammation.